U, and bear with me on this, U is for urinary alkalinization. It's a little rough because literally nothing starts with U, but we're going to use it as an excuse to talk about sodium bicarbonate and the changes that it makes to the pH of our bodies, thus the pH of our urine, and really some of its most useful changes or its useful effects. So for urinary alkalinization, we can use sodium bicarbonate for its toxicology effects, namely the reversal of tricyclic antidepressant toxicity and aspirin toxicity by making the urine alkaline with high dose sodium bicarbonate. Not even high dose, but just sodium bicarbonate. You can concentrate or pull those toxic agents into the urine and flush it out naturally. And so we can avoid things like dialysis, and we can pretty quickly reverse a lot of the signs of those toxicities. Similarly, bicarb has lots of other useful and recommended guideline-based, evidence-based uses. Has lots of things we use it for, but it has fewer things that it's actually recommended for. So there are 2 guidelines outside of toxicology, outside of urinary alkalinization, that sodium bicarb is recommended for. One of them is hyperkalemia. So we've talked about hyperkalemia in another video, but it forces an ion exchange, forces the potassium back into the cell. And so it is actually guideline indicated for hyperkalemia. And it is also guideline indicated in diabetic ketoacidosis if the pH of the blood is less than 6.9. Only if the pH is less than 6.9. And that is actually a pretty low pH. So patients can come in, patients can be very symptomatic, patients can have very high blood sugars, patients can have electrolytes all over the place. But if the pH is not less than 6.9, sodium bicarbonate is not recommended. And we will do electrolyte fixes and all kinds of other fluid correction and that kind of thing without actually correcting the pH. All the other reasons that we use sodium bicarb, we used to use it for nephro protection prior to different dye scans, even like ACLS, in the setting of ACLS for prolonged downtime. It actually is not, quote, not routinely recommended if you look at the guidelines. Really the only time sodium bicarbonate is recommended in ACLS is if you are treating a number. So you are treating a known hyperkalemia, known or suspected hyperkalemia, or you have an ABG, an arterial blood gas, that shows that a patient truly is acidotic. So we give it all the time. Sometimes I walk into codes and the patient's been resting for like 10 seconds and they've already given like 4 vials of, or 4 amps of bicarb. And I'm like, how does that happen? And it's to be honest with you, it's because we want to feel like we're doing something, but sodium bicarb is actually, quote, not routinely recommended, even in the setting of most ACLS scenarios. So that is a very brief overview of sodium bicarbonate, including its use in urinary alkalinization. That one required some grace. The end of the alphabet gets a little bit rough, so bear with me.